I'm always talking about how pain can be unlearned by the brain. Well, the person that I'm interviewing today is has written the book literally called Unlearn Your Pain. And he's also a researcher. He's been working on this for over 20 years, and we have a beautiful conversation. This is Wellness by Design. I'm your host, Jane Hogan, the Wellness Engineer, and my guest today is Dr. Howard Schubiner. And as I mentioned, he has written the book on Unlearn Your Pain and has a new book, which you can pre order now. He is an internist and a clinical professor at Michigan State University College of Human Medicine and has authored more than 100 publications in scientific journals and books. We have a super conversation, and I hope that this can help you bust some myths about chronic pain. And I'm looking forward to hearing your responses and how you enjoy this conversation. I'll see you inside. Dr. Howard Schubiner, this is such an honor for me to have you on Wellness by Design today because I have read your book, scrutinized your book. I really love everything that you teach, and I've listened to you on podcasts before. So really, really honored. And I quoted you in my book, Pain
Oh,
Free on Purpose. I
very
quoted you
kind.
in that book.
You're
Yeah.
too kind.
Well,
Thank you, Jane.
I love your work, and I love that you're not, well, you're a practitioner. I was going to say not just a practitioner. I mean, that is a huge thing, but also that you're a researcher,
Mm,
and that holds so much weight with people. We've been taught to trust the research, and I love that you've done that. So let's talk about what led you to do some of this research, and what were you doing before you were using a mind body approach to treating chronic pain, anxiety?
right. Yeah. My first job was at Wayne State University School of Medicine. I was a young faculty member. I worked up the ranks. I did a lot of research there on a variety of topics. I became a full professor in 2002. But uh, I switched at that point. I just switched jobs. I moved to a community hospital where I had a good friend who offered me a job, which seemed promising, and I wasn't sure what to do. And he asked me if I would be interested in reading a book by Dr. Sarno, John Sarno. And Dr. Sarno had been writing about this mind-body connection and pain, primarily back pain, but many other things as well, since the
Mhm.
1970s. I'd never heard of him. And this friend of mine had a person who had a remarkable recovery just by reading one of Dr. Sarno's books. So I read the book, The Mind Body Prescription. I was like, oh, this is really interesting. I'm looking for something new in my path, my career path at the time. And I called up Dr. Sarno. I went out to New York. I worked with him for a while. I came back. I set up a clinic, and I started talking to people who had chronic pain. And I started listening to them and learning about their lives and learning about their
Mhm.
pain and evaluating them from a medical perspective and also from a mind body perspective. And I just became blown away by the fact that people who had 5, 10, 20 years of chronic pain could recover, often in a few weeks or a few months, recover
Amazing.
completely. And this is unheard of, something I'd never thought existed. I never wanted to be a pain doctor because, the standard teaching was chronic pain was incurable. And here, people were getting better. And that just energized me and sparked me to reach out to people around the country, around the world who were doing similar work. We ended up doing research, tons of research. I ended up writing books and lecturing and all sorts of stuff just out of that spark, a different idea, a different way of looking at things. And that's made all the
Mhm.
difference.
Sure has. I've read John Sarno's books as well, and it is mind blowing. And I also have read Alan Gordon's book, and I know that were you the lead researcher on that on
The Boulder Back Pain
the
study,
Boulder Back Pain study?
I was one of the researchers. I was the
Okay.
physician who did the evaluations. Yoni
Hmm.
Ashar was the lead researcher in Tor Wager's lab. Yeah.
Well, I mean, that alone is really quite amazing, that study. And I know there's been a lot of others as well. And so you've been building and building this body of evidence to show there is another way we can deal with chronic pain, because most people think it's a life sentence, as you said. And,
Right.
you know, well, you know the statistics. I know the statistics. It's awful, and it's growing. And so obviously I read recently, it 2025, they are expecting in the United States that the pain relief industry is worth $81 billion.
Yeah.
And it's not even working.
Right. And that may not include the alternative models, which also can be very expensive. Yes,
Yeah.
there's been the diseases the diseases that kill us, stroke, heart attack, cancer, dementia, are not actually rising. And modern medicine has developed some good treatments for some of them, not dementia so much, and they affect men and women equally. But the chronic pain, chronic anxiety, chronic depression, chronic fatigue syndromes, those are increasing in society. They're affecting young people, not older people, as with the mortality
Mm.
diseases. And the modern medicine treatments are often ineffective for those conditions. And even alternative medicine treatments are often ineffective for those conditions, and people are stuck. And one of those things that's uh, important, I think, to recognize, to be authentic about, is that women have higher rates of
Yeah.
all these conditions. And it's not because women are weak. It's not because it's all in their head. It's not because they're crazy. It's not their fault. It's because I believe women have a lot of pressures on them in society. They have higher rates of emotional abuse in childhood. They have higher rates of sexual abuse, obviously. They have
Hmm.
higher rates of intimate partner violence. They have higher rates of pressure in the workplace, harassment in the workplace. They have higher rates of being caregivers for children and parents and everybody else. They're socialized to put themselves last and not be authentic and speaking for their needs or putting themselves first. And I
It's
think when you
awful.
put it that way, most women can kind of recognize that
Oh,
whole
yeah.
thing. Do you feel that? Does that make sense to you?
Absolutely. Oh, yeah, absolutely. And maybe there's different pressures even from childhood to,
Absolutely.
be the peacekeeper, don't speak, be the perfectionist, you
Exactly.
know, all of those things.
Exactly. And it's
The
not that
caretakers.
men can't get, it's not that men don't have these conditions. Many
Yeah.
men do, of course, because
Hmm.
this is a human condition. But the brain is like a smoke alarm. The brain sends out warning
Yeah.
signals or danger signals or alarms when the brain feels in danger. And research shows that a physical injury can trigger the brain to create pain or these other symptoms. But an emotional injury can cause the brain to create the exact same symptoms, the exact same things. And they're
Yeah.
real, they're not imaginary.
Hmm.
So what we have to realize is that when someone has pain or anxiety or depression or fatigue or some symptom, we want to know, is it a structural problem or not? Of course,
Hmm.
that's our job. That's being a doctor. I hold being a doctor very seriously. Rule out a structural problem. But the fact
Hmm.
is, and we've done research on this, that most people with chronic headache, abdominal pain, pelvic pain, TMJ pain, most people with widespread pain, fibromyalgia, most people with neck and back pain, the vast majority of those people do not, I repeat, do not have a structural cause for their pain. And this is shocking and mind
It is
blowing
shocking.
because the medical profession doesn't really understand that. And like I say, we've got a lot of data showing
Hmm.
that. But that's
And
a
it's hard.
revolution.
It is, and
Yeah,
it's hard for even the people with the pain to understand that. And often, when I start talking about pain in this way, I'll get some of the resistance. Like I haven't been making it up, and I know your pain is real. All pain is real pain, just
right.
because it's generated by the brain. And I love your analogy about the smoke alarm too, in another context about that it's just neutral, it's just an alarm, it's not something to fear. But we have we do fear pain. People, when they have
Yeah,
pain, they feel fear about their future, which then creates more pain, right? Because more
absolutely.
alarms are going off. So people get stuck in this cycle of pain and fear.
Absolutely.
Um,
And people say, well, how can it be my brain causing this pain?
mhm.
Because it's so severe.
Yes.
And the point is that all pain, like you said, is created by the brain. When you touch a hot stove, it's not your finger causing pain, it's actually the brain. And this is hard neuroscience. And it's
Yeah.
called predictive processing. Our brain creates what we see, what we hear, and what we feel. And so this 10 out of 10 pain that's like a kidney stone or like labor still can be caused by the brain in the absence of structural damage. And making that distinction is so vital because if you if you have back pain, stomach pain, pelvic pain, whatever, you're going to the doctor and they're saying, well, you need medication, you need injections, you may even need surgery. That's going down a path that assumes that it's a structural problem. And
Mm.
if you assume that, you can be wrong. In fact, you will be wrong most of the time, which is shocking.
Yes.
But you need a different path. You know, the treatment has to fit the condition.
And people's beliefs play a big role as well.
Yeah,
So I know in your book you talk about it's almost like the degree to which someone can say there's nothing physically wrong with me
yeah.
is the degree to which their brain can start to begin to let go of pain through the processes that you teach.
Right. And we
Um,
look for the evidence. You know, it's not, we
yeah.
don't just see somebody and say, oh, your pain's coming from your brain by definitions. We don't know. We don't make that assumption. We want to
Mhm.
look for the evidence. You know, there was a
Yeah.
guy I met a while ago who had 25 years of back, leg, and then foot pain. 25 years. So it got so bad he couldn't sit because of the back and butt and leg pain. And he couldn't stand because of the foot pain. So he had to quit work. His life was reduced to nothing, lying in a recliner, nothing, you know, depressed, suicidal. And he found out about this work. He looked at one of our podcasts and he said, that's interesting, but could that possibly apply to me? 25 years severe pain? And then one day he had a level like 5 pain. He was walked into a pharmacy to get a medication. And as he walked in, he saw a long line. And as soon as he saw the long line, he knew he was going to be standing in the long line. And as soon as he saw the line within 3 seconds, his pain had jumped from a 5 to a 9.
Interesting.
And that was his moment. This is what we call the
Mhm.
click moment, where it just clicked for him. This is what it is. I get it now. And then once he had that click moment, once he understood it, he then started he had a physical therapist said, you need to walk. He said, well, I can't walk. It hurts too much. He said, I know, but you're not injuring yourself. You're not damaging yourself. It's your brain causing pain. Walk. So he walked a little bit and he kept telling himself, I'm safe. I'm okay. I'll be fine. But he knew it was true. I'll get better. And he walked more and he walked more and he walked more. Within 6 weeks, his pain was gone after 25 years. It's astounding that that can
It
happen.
is. Uh, yeah, it is incredible. I think I know, people who have had headaches for 20 years.
Yeah.
Nothing showing up, like, but yet they feel like it's, a physical thing. They really feel
Of
like there's a
course.
physical,
Of course.
yeah, of
I
course
mean,
they do.
it's physical in the sense you feel it in your body and it's
Yeah.
real, you know, even when it's learned neural circuits in the brain, that's
Mhm.
physical, it's real. It's just not what we would call, in medical sense, pathological. There's no tumor that needs treating. There's no infection that needs treating.
Mm.
There's no inflammation that needs treating. It's neural circuits in the brain. And that's, that makes all the difference in the world.
Mhm. And I think, and do you ever run across this that people like it's almost becomes their identity? If
Mm,
they've lived with pain for a long time, it's like part of their identity, and it's almost like,
yeah.
well, what if this was just pain that was generated in my brain? Like, does that mean I've been crazy all these years?
Yeah, and then it's so easy to get offended, you know, and who does
Mhm.
you can't blame people for being offended or, you know,
Mhm.
if they think they're being dismissed or invalidated. Nobody wants that. Nobody deserves to be dismissed or invalidated. Certainly not women. Women have been dismissed and invalidated for centuries.
Mhm.
So
Mhm.
certainly we don't want to fall into that trap or that camp.
Mhm.
Um, and we also don't, but we also want to say that there may be hope, because hope is a powerful thing. And when you lose hope, because you've tried so many different things for so long, it's devastating to,
Mhm.
to live that way.
Howard, what it doesn't seem like there's one name on this kind of pain. I've heard,
Mm.
like, in the John Sarno book,
Yeah,
he
yeah,
called it PMS. I noticed you were calling it mind body pain. Other people call it neuroplastic pain.
yeah.
Has the community, settled on a name for this type of pain?
I think we're close. We're calling it neuroplastic pain,
Okay.
or
That's what I've been
neuroplastic
doing most of the time.
symptoms and neuroplastic conditions. I have a new book coming out, and the book is filled with the word neuroplastic, because neuroplastic is neuro, the brain, and
Yeah.
plastic means plasticity. It can change.
Yeah.
And that's the hopeful message of understanding that the brain can learn pain, and it can unlearn pain. It can learn
Yeah.
anxiety, and it can unlearn. It can learn
Yeah.
fatigue or brain fog or dizziness or tinnitus, and it can
Mhm.
unlearn those things. And that's why we're using. And then this overall treatment we're talking about now, we're talking about a term, neuroplastic recovery therapies.
Okay. I
Right.
like that.
So it's
Mhm.
neuroplastic recovery therapy, and that includes understanding. It includes the evaluation, making sure there's no structural condition. It
Mhm.
includes education about how the brain works, how the brain can and often does create real symptoms in the absence of structural damage. It includes the therapy, pain reprocessing therapy. And we've got good research on that, and it includes
Yep.
emotional awareness and expression therapy, which we also have good research on showing that both of those are effective and more effective than standard psychological treatments for chronic pain. And it includes finally how we treat ourselves, how people
Mhm.
treat themselves. Do they care for themselves? Are they kind to themselves? Or how critical are they of themselves? How much do they assert their needs or stand up for themselves, or stop this over guilting themselves, or over
Over guilting.
perfectionizing, if that's
Yeah.
a word, themselves. And
Uh,
so that's the motto, those 5 steps, and
I
it's
really
all
like all that.
included in
Mhm.
that. Yeah.
Because, that last part that you mentioned, like, how you feel about yourself, you know, that is huge.
Yeah.
It's really huge how people view themselves, because that can also change their motivation, right, for making some of these changes, doing the practices that are going to support,
Yeah,
releasing the pain.
yeah,
Um, I'd like to circle back to, like, how do we diagnose this neuroplastic pain
yeah,
versus pain that's from a structural cause? Because a lot of people will say, "Well, no, I've had the MRI. I've got a bulging disc, or I've got,
right,
a rotator cuff tear, or
right,
these types of things, or I've been diagnosed with an autoimmune disease, like I was."
right, exactly. So we want to keep an open mind. We don't want to
Mhm.
just assume one way or the other before
Yeah.
delving into the data and looking at it carefully and closely. That's number one. Now, the next step is the structural side. We look for a structural problem. If someone has a cancer, an infection, a fracture, those are structural conditions that need to be treated first. Um, But we don't want to overinterpret a structural problem being there if the X-rays or MRIs show something that is also seen in healthy people without pain. And so the research shows very clearly that many people, as they age, have degenerative disc disease of the back without pain, have bulging discs without pain, have annular tears, spondylolisthesis, a variety of mild MRI abnormalities without pain. It's the same with knees and shoulders and hips. There are very good research showing that many people have labral tears, osteoarthritis, uh, other impingement syndromes on X-ray or MRI without pain. So when someone has those conditions on imaging, we shouldn't assume that that's the cause of the pain. We need to keep an open mind and investigate. farther. How do we investigate farther? Well, we use what I have developed and called the FIT criteria, FIT, functional, inconsistent, and triggered. So we look for the symptoms. Are the symptoms in a very wide area of the body? Well, that's a functional issue. Was it precipitated in the middle of the night without any injury? Is it bilateral on both sides of the body? Inconsistent. Does it come and go, turn on and off? Does it move around? Is it spreading? Is it triggered by the weather or by sound or light or smells or foods? And so we're looking for all these clues, just like I was talking about with the guy with the pharmacy when he walked in the pharmacy. That was his clue.
Mhm.
And that's what we're doing. So when we put it all together, and I've been doing this for 22 years, 23 years, whatever, almost 23 years. And it's not that hard. It's really not that hard. And that's what I write about in my books. I lay out all the criteria so that people, and usually people can figure it out for themselves reasonably well.
Mhm.
So that's how we do the assessment.
Uh, e- Arthritis is a big one that people just
Yeah,
assume if they've
right.
got arthritis, that's the source of their pain,
Well,
and they
everyone
need to.
has arthritis on an X-ray. I have. I
I
mean, I
know that's what
just I
people don't
just
know.
saw a lady, a friend of mine. She's a 78-year-old retired doctor. She had neuroplastic pain for many years. She recovered using our model. She was walking in but she was walking, but the race was 112 miles. 112 miles. She tripped
Wow.
on the 105th mile and broke her
Oh,
clavicle. This lovely, lovely woman. She's amazing. And she broke her clavicle. So they took her to the hospital. They x-rayed her clavicle was broken. The x-ray of her shoulder, which was right next to the clavicle, showed end-stage osteoarthritis. That's what it showed. She has no shoulder pain.
hmm.
So, so you can't assume just because the x-ray is bone on bone, you can't assume. You have to investigate further. Now,
Mhm.
with autoimmune disorders, it's a little bit trickier, and you had that. Autoimmune disorders do cause inflammation. Most people with chronic pain don't have inflammation, but autoimmune disorders do when they're active. And so a lot of times autoimmune disorders can become inactive, can become dormant, and people can still have pain that's neuroplastic pain. Or um, the brain can actually influence the immune system. So there's a
Yeah.
field called psychoneuroimmunology, and we know
Yeah.
from a lot of research that the brain can affect the immune system. So even people with autoimmune conditions often can recover using our model, or sometimes they use a combination of medications plus
Mhm.
neuroplastic treatments. And so that's kind of a special case.
Mhm. I also think about with autoimmune conditions how I think in nearly all cases there's also, the leaky gut component, but I kind of see that can trigger the immune system. I also see that because of the neuroplastic, not pain, but that's triggering the nervous system into the fight or flight mode and kind of stuck there most of the time, that can interfere with digestion. So that could be a mechanism that leads to the autoimmune, but it's still sort of coming back to it's a stress response.
Mhm.
And I knew that in my case because I had had a stressful year,
Yeah,
and then so I knew it had to be that, and
yeah.
it just wasn't something else.
There's a lot of
So,
theory. There's a lot of theories about how the body's involved, and a lot of practitioners don't feel comfortable talking about the brain, don't feel comfortable
mm,
talking about stress. A lot of practitioners, more maybe in the alternative model, want to talk about leaky gut, or they want to talk about, myofascial inflammation, or they want to talk about a variety of things that take back to the body. Um, and when we've looked at those things closely, what we find is those things may be there, but they're not the actual cause of the
yeah.
symptoms. Like everyone
Hmm.
has some mild, low-level inflammation in their body. Everyone has that in their in our gums, in our arteries. That's been shown. And stress can cause more inflammation in the body. But
Hmm.
our view is that's not the actual cause of the pain, and we know that for a couple of reasons. One, corticosteroids are the most powerful reducer of inflammation. And corticosteroids reduce pain in rheumatoid arthritis, lupus, autoimmune disorders where there's macro inflammation. But this low-level micro-inflammation, corticosteroid, like quote in fibromyalgia, leaky gut, myofascial pain, steroids don't help that at all.
Hmm.
So it doesn't make sense to me that the inflammation is the actual cause of the symptom when steroids don't help it. And there's a variety of other evidence. For example, neuroplastic pain can turn on and off. It can go from a 5 to a 9 like that, right? Like I just said,
Mm-hmm.
inflammation can't change that fast. That doesn't happen.
Mm-hmm.
Inflammation is a slower process that occurs over days, weeks, or months. So, you know, I, it's hard for a lot of people, both people in the world and also practitioners, to really grasp the power that the brain's neuroplasticity has over us. And that's the work that we do. And that's why I'm writing about this from this
Mm-hmm.
medical scientific, point of view. My new book has over 800 medical references, all about neuroplasticity, all about the power of the brain.
So good. I'm over 200 episodes in this podcast now, and I've hosted a summit on chronic pain twice. And I always ask about the role of stress.
Mm,
Because some people are on there, they're all about the gut health, and other people, they're
right,
all about whatever their specialty,
right,
hormones, whatever it is. Um,
exactly.
and I always ask, how much does stress play? What's the role of stress in your, do you see in your patients? And they'll always say that stress is huge. They
Mm,
kind of know it.
yeah, yeah,
So there's always that
right,
component.
right. It's just they're
Um,
reluctant to give up the physical part of it,
yeah, yeah.
which I
I see that for
understand.
sure. Yep, yep.
But I think I can take away from recovery, in my opinion,
Mm-hmm.
because when people hear, well, there's your gut's got a problem and it's stress, or they hear, you've got inflammation and it's stress, or they hear you've got, bacterial overgrowth, or you've got, all sorts of other things that people are saying, loose joints, et cetera, loose ligaments. They really focus on that, and it makes it harder to really
Mm-hmm.
go all in on a neuroplastic recovery. And going all in, as you mentioned at the beginning, going all in on a neuroplastic recovery offers a much greater and quicker path to recovery.
Mm-hmm. I learned that. Your 6 Fs that you talk about in the book.
Yeah,
One of them you just
right.
mentioned was the focus, and that's where I was. I'm an engineer, and I
Mm,
was an engineer, and I just focus on, like, let's get this done. I'm going to solve this problem, and that, I think, actually slowed down my recovery, being so hyper focused.
right.
Just.
Yes, because pain reprocessing therapy is based on the idea of lowering, as you mentioned, lowering fear of the symptom, lowering
Mhm.
focus on it, lowering frustration with it, realizing that it's there, as a guide, as a message, as something that's trying to help you, alert you to a problem. It's lowering, it's lowering this fighting it. It's lowering trying to figure it out endlessly. It's lowering
Mhm.
trying to fix it, because if it ain't broke, you don't really have to fix it. And that calming and soothing that can really come when you really realize that there's hope for recovery, that you're going to get better, that
Mhm.
this actual sensations are annoying, so frustrating, but they're not actually dangerous. And you can use the techniques that we've used to help gradually lower the danger signal in your brain by how you treat yourself and how you talk to your brain about it, and how you live your life. So that's pain reprocessing therapy. But
Mhm.
in addition, there's the emotional awareness and expression therapy part of it too, because a lot of people in these situations have the genesis, the start of them had to do with, in some part, childhood trauma to some degree, and other situations in their life. Saw a lady, one of my most amazing patients, when I first started doing this work. She described her childhood as fine, it was fine,
Mhm.
but her father was unpredictable. When he came home, some days he was happy and good, and other days he was mean and angry, and he would yell and he would scream and he would grab her and shake her, not shake her so much, but scream at her. And scary for a little girl, obviously. And she
Mhm.
grew up and she was fine until she was in her like late 30s and she started getting headaches. And she had headaches for 17 years.
Mm.
And no one could help her. All these specialty headache clinics, et cetera, et cetera. And when I met her and talked with her, just talking with her, and when the headaches started, it turned out she had a new boss, and her boss was unpredictable, just like her
Right.
father.
Similar situation. The
And that
brain had a pattern.
the brain had the sensitization of that emotional trauma, even though it was a long time ago, but it was very specific. And then it got reproduced and triggered by,
Mhm.
what was the headache? What was the message of the headaches? It was, don't tolerate this. Get out of there. You're in danger.
Mhm.
This is a bad situation. And so, you know, the headache started while she had that boss. She left the job, she changed jobs, whatever. Boss wasn't there anymore. But for 17 years, the headache became a cycle, became a pattern. And once we realized what was causing it, we could look at it in a totally different way. And she could begin to process some of the emotions around the boss and around her father as well, going back. And that's
Mhm.
what emotional awareness and expression therapy offers people the chance to do, which is pretty amazing. And oftentimes when we do these emotional expression exercises, we're going through feelings of anger, feelings of guilt, feelings of sadness, moving to compassion. And people's pain can often just turn off right on the spot when they do that. Not
It's
necessarily
like that.
forever, but you can see the rapid change due to emotions.
It's kind of like I think about sometimes like one of those beach balls, and you're trying to keep it underwater, right? And it takes a lot
Yeah,
of effort. And so when you can just let it go,
right.
it's
Yeah,
the effort can release.
yeah, yeah. I
Um,
love that.
yeah, I really like that you've got this emotional component as well. Um, okay, I want to ask you, Howard, about like I'm thinking about some of the things that come up with people that I work with. Sometimes they'll say, well, I'm trying, I'm getting out walking. I'm trying to tell my brain I'm safe. But
Yeah,
every time I hit that, 1 mile mark or the pain starts.
yeah,
And so how we know, you and I know that that pain is not dangerous, but
right.
what's a, what's your strategy for helping talk people through that the pain isn't dangerous when they're conditioned to think
Yeah,
this pain is a problem when I walk too far or whatever it
exactly.
is they're doing.
Yeah, exactly. Well, again, we want to make sure that they're clear, that they know it's not structural, going back to the assessment, making sure that's clear. Because if there's doubt about that, that's going to feed into getting pain and having it persist. Uh,
Hmm.
and the other thing is that I often recommend people visualize walking with joy, visualize walking with safety, and just get that in their brain because they want to train their brain that walking is safe. So visualizing it with the self-soothing and safety messages to the brain is important. And then when they walk, they want to continue to do, as you said, give themselves messages of safety. And they don't want to walk to the point where they get pain and stop, because that actually reinforces that pattern. What they
Yeah.
want to do is walk to a certain time or a certain distance, no matter what. And so if let's say it's a mile where they start getting pain, I would probably have them do visualizing walking with safety and joy, and walk for half a mile, half a mile, half a mile, half a mile. So they're teaching their brain walking is fine, and they're happy, and they're really enjoying it. Not just
Hmm.
walking, but enjoying it, taking it all in. And then 3/4 of a mile, and then a mile. If they get pain at a mile, fine, keep doing it. And then a mile and a little more. Keep going. Teaching their brain that they're going to be safe, and they'll get better.
Hmm. It's that rewiring, right? It's giving the brain a new experience
Exactly.
with that pain. I really, really like that. Okay, so you've got a book coming out.
Mhm.
Two books coming out. Two books.
I'm retitling. My old books are getting retitled as workbooks, and I have a new book coming out for Penguin Random House. It's called The Open Field is the imprint from Maria Shriver, and it's called Unlearn Your Pain, The Science of Recovering from Chronic Pain, Fatigue, anxiety, and depression. It's kind of a mouthful, but Unlearn Your Pain is the name of the new book.
And that's so brilliant. I mean, Unlearn Your Pain was the title of your other
Original.
book as well,
Right,
but
right.
it's so empowering. I just love that Unlearn Your Pain because it's just puts people in a, it's in the power position. Well, I know how to learn things.
Yeah,
Okay, I
yeah,
can unlearn this. So we're teaching the brain something new. So people can pre-order the book now, right?
correct.
Okay, we'll have the links there. Or do you know the link off the top of your head, or we'll just
No, it's on
provide the.
Amazon.com. I don't know.
Okay,
Yeah,
Amazon.com. Go look for the book and
yeah.
find it so you can pre-order it. And it's
Yes,
coming out in May. Is that right?
right, correct.
All right, excellent. Well, I'm going to pre-order it because I
Oh,
love the work that you're doing. Is there anything that we haven't? There's something I want to ask you about,
sure.
and maybe we've kind of covered it before, but you mentioned there that it's like if people have any doubt, because sometimes I think there still is this doubt that,
Hmm.
well, but my doctor said, I'm bone on bone on my knee, and that's the cause of my pain.
Sure.
So even though try to show them this, I think there's still those kernels of doubt.
Hmm.
How do you help people remove those doubts?
Yeah. Well, you want to look for those inconsistencies because the
Mhm.
inconsistencies are the most important thing. Does the pain shift from one part of the knee to the other? Is it there is all the time, or does it come and go? Is it sometimes there when you do a certain activity, but sometimes it's not there? You're really looking for that evidence, and you want to make a list of all those evidence, right? Because the fact of what the X-ray showed is not it's not that it's irrelevant, but it is unlikely to be the whole story, and it may be have nothing to do with it. Like I talked about that lady who broke her clavicle, she had severe end-stage osteoarthritis, no pain at all. So
Mhm.
knowing that and understanding that the X-ray is not, you shouldn't assume that that's the cause, and look for the evidence. The brain requires certainty. Our brain
Mhm.
categorizes things quickly. That's how we survive. That's a survival mechanism. You're walking down a path. Is it a snake or a rope? You're walking past a person, friend or foe. Our brain constantly categorizes into safe or not safe. And when you're living with your feeling like your body is not safe, that's it's just not a healthy and safe and caring and, great, good way to exist. And
Mhm.
if it's true that you actually are safe in your knee or your shoulder or your stomach or your head, if it's actually true, then you want to go all in on that because the brain needs certainty. When you get
Mhm.
a pain or a symptom, your brain is asking you a question: Are you okay?
Right.
It's asking you a question: Are you okay? And you have to answer that question. And if the answer is no, it's hurting, it's horrible, I can't handle it. Well, I can't take it, right? Well, that's giving your brain the message you're not okay. And the brain's going to use that feedback to continue giving you that symptom.
Mm. I like that. The brain needs certainty.
Yeah,
And so I think that again is another empowering kind of way for people to really help their brain unlearn the pain is like, okay, if my brain needs certainty, I'm the one that's got to give it that.
exactly. It's like being a parent. How do you raise a child?
Mhm.
You raise a child with clear rules, with love and kindness and patience and generosity, but also clear rules. These are the rules. This is the story. We don't run in the street. No, 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 no. And I don't care.
Yeah.
We don't do that. And it's giving that certainty because kids need structure and certainty in their life to feel safe, and that's exactly what our brain needs.
So that idea, thinking about the brain as a child that needs training,
Yeah.
and
It's
that
scared. It's
we,
scared. It needs soothing. It
yeah.
needs love. It's scared. It's afraid. It's fear,
Mm.
right? It's fear that there's something wrong, fear of something in one's life. So we need to
Mhm.
calm and soothe that fear as if, we're a child lying in bed fearful of a monster in the closet.
Mhm.
Yeah.
That's such a compassionate approach as well, which I really like. towards the brain. Because,
Yeah.
even in this, we can think, well, our brain's kind of our enemy because it's turning on pain. But to look at even the brain with compassion, that it's just
Yeah.
trying to do its best.
Right. And we
But
really
it
want to
means,
be compassionate to ourselves. Oh,
mm-hmm,
I'm here. I'm with you. Speaking to ourselves, I'm with you. I'm here. I'm here for you. I won't abandon you. We're in this together.
mm-hmm,
We'll get through this. Even though it's hard right now, I'm here. It's showing up for yourself that everybody needs. Everybody needs to be their own mom or their own dad. I really, truly believe that.
I think so. I think you're right there, Howard. So is there anything we haven't talked about yet that you really want to make sure the audience hears?
um, Not really. I just think that I want to make sure that people continue to have hope, and
Mm,
don't give up, and keep looking for those moments where they can really figure things out. Keep looking for those moments to be authentic in the world. Keep looking for those moments to connect to other people who are caring and loving. Keep looking for those moments to be compassionate to yourself. Those are the things that make so much difference.
mm-hmm, certainly do. What would you say is a baby step someone could take? Just a little tiny thing they could do today that's going to shift their body into that healing state where they could begin to let go of pain or even anxiety, anything like that. What would you
Often
say
one of
that?
the first things you can do is visualize yourself doing things that give you joy, even if they're especially things you haven't been able to do, like sitting.
Mm,
Imagine sitting with joy. Imagine walking with joy. Imagine
mm,
working with joy. Imagine playing the guitar with joy. Imagine going out for lunch with friends with joy. Imagine doing those things with safety and calm and joy to get your brain moving in that direction, and
mhm.
then starting to do those things little by little.
I love that you said that because it's one of the first things I do with people as a little guided experience,
Hmm.
um, to help them have that experience of lowering pain. Because I mean, it always blows my mind, Howard, that people will, I get them to rate their pain before and after, and people will go from an 8 to a 4 or a
Mm.
5 to a 2. Or one person, she said, had sciatica pain for 10 years. And in this like little 5-minute visualization I let her
Yeah,
through was gone.
yeah,
I mean, it's mind blowing.
right. That's your evidence. That's the click moment.
Yeah.
So now you don't
That's
have
why I
to
do
worry
it.
about it anymore, right? Now you know.
Yeah. Give them
Perfect.
that experience
Yeah,
of them doing it themselves. Then it's just repeat.
exactly.
I love it. All right. So, where's the best place for people to find out more about your work and follow you?
Um, well, my website is unlearnyourpain.com.
Hmm.
I work closely. I'm on the board of directors of the nonprofit Association for the Treatment of Neuroplastic Symptoms, ATNS. Their website is symptomatic.me, and that's our nonprofit. We have an annual conference. We've got a ton of membership opportunities, low cost. Anybody can join it. It's not only for professionals. We've got questions and answer, forums, all sorts of stuff on our website. There's the tmswiki.org is another peer-run nonprofit free organization that has a ton of information.
Hmm. Thank you. And we'll put those links in the notes so people can find that. And I just want to say thank you so much for this work, for shining a light on the fact that people don't have to live with pain, that there's not always a physical symptom. There's something that they can do. I mean, you're really changing things. So, just thank you so much for the work that you're doing, Howard.
You're very kind. I appreciate it much. I love doing this work, and I love that you're doing it too. So thank you.
Mhm. Well, you've inspired me, and other people. So thanks so much for being here, for the work that you're doing, for being a guest on Wellness by Design today.
Thank you, Jane. Appreciate it.
All right. And to everyone watching and listening, wow, this was amazing. So listen to what Howard said, maybe re-listen to this, maybe share this with someone who needs to hear it. Chronic pain isn't a life sentence. There's something you can do about it. You can be empowered. So I hope you really enjoy this, and I will see you again on the next episode of Wellness by Design.